Okay, Carissa, we already completed our oral mechanism exam, and now we're going to move on to our food trials. Like I did with the oral mechanism exam with this dry swallow, after each item is presented to you, whether it be a liquid or a different textured food, I'm going to gently place my fingers on the bottom, just across your neck, and just make sure everything's going down correctly with your swallow. So, and after each time, I want you to sustain ah, just to make sure that nothing got into your airway and that everything's still good to go. All right? Do you have any questions?
No.
Okay. All right. Well, I'm going to start you out with just a half a teaspoon of water. So, okay. Okay, very good. I'm going to give you a little bit more. So, okay, a full teaspoon. Okay, very good. Now I'm going to help you with, take a sip of this out of the cup. So, okay. Okay. All right, now I'm going to let you take a couple sips by yourself, or just one sip by yourself. Okay, 1 second. Okay. All right, thank you. Okay, well, now we're going to use a straw, and I'm just going to let you take one sip. Okay. Okay, all right, very good. Now, just take one sip, okay? You can take it on your own. Okay, just one. Okay, all right, now you can take a couple sips if you'd like. Okay. All right, very good. Okay, well, that was very good with the water. Next, we're going to move on to what we'd consider a pureed food. So that doesn't have any lumps or any kind of pieces in it. So we're going to start with vanilla pudding. So, okay. All right, and the same thing, we're going to do just the same way. So I'm just going to give you a little bit on your spoon. Okay. Okay, perfect. Now I just want to double check your mouth and make sure there's nothing got left over. All right, very good. I'm going to give you a little bit more. Do about half a teaspoon. Okay. All right, perfect. Again, check for residue. Okay, all right, very good. Okay, now I'm going to give you a full teaspoon. All right. Okay, you done? Can you sustain? All right, good. Let me just make sure there's nothing else in here. Okay, all right, very good. All right, now you can take a bite on your own, just what you'd normally do. Okay. Very good. Check one more time. Okay, all right, you did very well with that. So that was for our pudding. Now we're going to move on to our next texture, which would be considered mechanical soft. So, all right, let's just clear this off. All right, now this is applesauce, and it's like really chunky, so there's still some pieces in here that you're going to have to chew. So, okay, all right. And we're going to start off again with just about half a teaspoon. Okay. Okay, good. Just gonna check again. All right, very good. Okay, now we're going to do a bigger teaspoon, just a little bit more. Okay. All right. Good. All right, one more time, just checking your mouth. Okay. This way. Okay. Very good. Now I'd like you to take a bite which you normally take on your own. So, here you go. Very good. Alrighty. Let's check one more time. Okay, everything looks good. Alright, you're doing very well. So, okay, Caressa, so we've already finished our first 2 trials, and we're going to move on to our last one, which is just regular foods. So, I have a ham and cheese sandwich. So, alright, we're going to go ahead and get started. So, I'm just going to give you this small bite first. Just take as much time as you need chewing. Okay, is everything clear? Okay, I'm just going to check real quick. Good. Alright, very good. Okay, now we're going to try a little bit bigger bite. So, alright, you ready? Alright, very good. Check again. Okay. Alright. Very good. Okay, so well now this time you can take a bite for yourself. So just what you normally take a bite. How you normally take a bite. Alright, very good. Let's check this last time. Alright. Alright, no, that looks very good. Okay, alright, well, thank you, Caressa. We're all done. Thank you.